Hi everyone, this is a setup for ThermoClearPro. ThermoClearPro comes packaged to you from the manufacturer in California, and it comes with all of these things in the box. So you'll see that it comes with the probe connector, which I'm going to undo and show you. This guy, it has this curly Q weird kind of tip on it. It fits perfectly in this curly Q weird kind of spot, and you just twist it to ensure that it's locked in. You'll see it lock in there. This is what holds your actual probes, and it will unscrew so that you can put a new probe in and screw in to secure it. Okay. This is a non-insulated probe that we use for a lot of different treatments, and this is an insulated probe that we use for larger things such as skin tags and things like that. So it's very easy. You just take that out, secure it into the bottom, and tighten it down. There's a plastic cover on the top of the probe to protect it, and that way you can leave it set up on your mayo stand or table or wherever you're preparing for your client. This has a foot pedal, and you want to put this down on the floor somewhere that is close by so that you'll see when I turn it on, it indicates on here that the current is on, which means there's current flowing to this probe piece. The options for the foot pedal are auto and manual. Auto would mean that if you are only conducting current when it picks up that you are touching something. I'm a manual kind of girl, so I like to only know that I'm getting current whenever I'm pressing the pedal. It's completely your preference, but it's designed to reduce fatigue on the user and just as a safety option. In addition, there's a timer that will tell you how long you have to utilize this once you start providing treatment, and it will back off and stop the current flow. That is also designed as a safety feature. And then you have an option for high frequency and low frequency. This would be a high frequency treatment setting, and then you have low frequency would start out at 40, and then you would work your way up with these indicators here. It also comes with a complete user's manual. In addition, the vendor has a great website where you can go and download a user's manual and some other information for training on your own. With the purchase of this device from me or anyone at Everything Aesthetic, you are welcome here at the studio to a 2-hour training session, at which point I will supply you with models. I will supply you with everything that you need to get started with the device. And the purpose of going off-site for training would be that you are with limited distraction. You are not contaminating your pool of clients with training on potential clients. And when you go back, you will be trained and ready to use this device on your client pool. I also go through giving you the ability to integrate this in with your other devices, show you how to do consultations and how to promote this device within your client base. And if you add this in as part of your consultation by showing a client a mirror and asking them what concerns them on their face, oftentimes this device can pay for itself quickly and easily. This is a safe treatment. It is very effective. Hi guys, thanks for tuning in today. My name is Liz Munn, and I'm here at SkinPro Studio, and I'd like to show you ThermoClearPro. This device is wonderful for the esthetician that is trying to treat surface imperfections in the skin. the important thing there is surface imperfections. This is not necessarily considered a medical device. This is more for an aesthetics practice, and primarily because it does only treat the surface of the skin. With this device, you can treat cherry angiomas, you can treat spider capillaries, you can treat skin tags, as well as sebaceous hyperplasia. You can also remove surface skin sunspots, and even do electrolysis with this device. So I want to walk you through how to set this up and kind of what we have going on over here. This is a true low frequency device, and you'll see on the device that it actually gives you, it'll tell you when you're on low frequency or high frequency. And the difference would be low frequency is more skin friendly and would allow you to work on higher Fitzpatrick's without concern of pigmenting or causing damage to the skin. It also has an auto or manual foot pedal control and a timer. The foot pedal is down here on the floor, and I prefer to not use the auto, and basically the difference would be if you want to only use it on auto, the sensor will detect when you touch the skin and it will start the flow of current that way. I prefer to just put my foot on the pedal and focus the current in that manner. Timer will also give you a certain amount of time. A lot of people who use this device want to make sure that they don't exceed a certain amount of time limit during the treatment. So this is my husband, Hank. He is graciously agreed to be my model today. And I am going to be treating this sunspot here on his skin, little sebaceous hyperplasia, and a cherry angioma. Through the magic of video and husbands as they are, I have numbed his skin. I like to use Numb Master. It's 5% lidocaine. You can get it from me. It's easy to use and apply. It comes in a multi-dose tube that you would remove with a popsicle stick, apply to the skin. It takes about 15 minutes for you to have some effective topical anesthetic. These are the probes that we use for the device. This is a non-insulated probe, and this is an insulated probe. It's already in the handpiece here. This one's primarily used for skin tags and larger things on the skin. 9 times out of 10 you'll use this insulated probe over here. You'll also need tweezers, and specifically the back of tweezers, which is interesting, but we'll cover that in just a minute. And some Q-tips. I like to use alcohol swabs to remove the anesthetic and just to allow me to keep the area clean. And of course, cleanser, gloves, and aesthetic wipes. Just going to use a little bit of cleanser. Turn your head for me just a little. Thank you.
Keep going.
So I have the device set on 40, and I usually always use a lower setting, and then if I need to raise it, then I do. It's always easier to add than to take away. You don't want to over-treat the skin, and this will usually get you where you want to go. I removed the cover off of the probe, and I'm just going to touch this cherry angioma, and you will see that once I find the vascular source, it will blanch over white. So here we go. And as you can see, it is starting to blanch over, which means that we have found the source of this vascularity, and this skin will change color. And this was a larger cherry angioma, and I chose that one for demonstration purposes so you could really see how that worked. and we are done with that area. Sometimes if you have something larger on the skin, you may need to come back in and retreat it again. Again, I always err on the side of, if I have to retreat it, I do, but most of the time I do not. But do not over treat the skin. That's very important. This is a small sebaceous hyperplasia that I'm going to treat on Hank. It's right here in this general area. It may be difficult to see, but once I solidify that oil, you'll be able to see me remove that with the back of a tweezer. So again, we're looking for moisture in the skin, and there is moisture in this oil gland, so I am not going to wet the surface of the skin, and we'll just treat this and scoop it out. When I treat these, I treat the perimeter and then make sure that the oil under the skin has solidified. And once it does, then I can take the back of this tweezer, and you'll see that this easily removes that congested oil off of the surface of the skin without going too deep into the skin. Remember, we are working on imperfections only. And now you can see that that skin is a little pink, and it is ready to begin healing again from the inside out. So it's important to remember whenever you are treating things that that we're discussing, that you don't apply growth factor or other heavy antioxidant products onto the skin. I'm actually going to apply just a little bit of a Benadryl based, hydrocortisone based type ointment to the skin, and that will be his instructions for the next several days. So since we have treated those two areas successfully, we're going to go ahead and I'm going to use an alcohol swab so that I get some good moisture on his skin. So I'm just going to take this alcohol swab, and I have been working on this spot on Hank's face for a while. You can see that it's now kind of 3 different quadrants, if you will, of a sunspot. Hank has seen his dermatologist, which is also something I suggest estheticians do. A lot of times it's this is just for appearance. This is for an aesthetic value. We are not treating the skin or diagnosing the skin. So if you are unsure of what something is, have your client see their dermatologist and supply you with information on what's going on with them prior to treating them. Seeing as I'm involved with his healthcare, I know that this is just a sunspot, and he has seen the dermatologist about this. So I'm going to moisten this with our alcohol swab, and then you'll see me just kind of create a tic-tac-toe kind of mark on this. And what will happen is the skin will get darker, and then it will flake away over the next several days. So it will continue to process. With this particular kind of scenario, you always want to make sure that you leave some unwounded skin on the face so that it can heal. So you also see that it's starting to flake up just a little bit on the skin. That's not uncommon. There are times whenever you have a smaller area that it may actually just peel off onto the probe. It may not always remain on the skin. So I'm going to do this just in little quadrants and get Hank taken care of here. And you can see that this is processing nicely for me. I'm actually still at 40. I'm going to increase my my frequency up to 55, just to give me a little more energy to treat this with as few passes as possible. You see how it's getting darker and darker there. And that will continue to process and then flake away over the next several days. The last thing I kind of want to show you, it might be difficult to see on camera, is Hank has a few spider capillaries here. It works in a similar way as this cherry angioma, but I'm just going to take the probe and I'm going to touch the surface of this capillary, and just it will disappear on me as soon as I get, there it goes. As soon as I reach that vascular source, it will disappear and no longer be visible on the surface of his skin. Again, this does not affect his skin's overall health or circulation, because these are non-functioning spider capillaries that really just are there with a poor appearance. The last thing I just kind of want to walk you through with this device is how you would integrate it into your practice. Okay, so we are finished treating these couple areas on Hank's skin, and you can see that he is starting to get pink and he's having a histamine response. So similar to the way that you might have a response to an injury or a bug bite or something like that, you're going to have that same kind of reaction from this. This is just, again, a little bit of a calamine lotion gel with a little bit of a Benadryl type product included in there that I'm going to apply here just to control that histamine response and control any kind of itchy puffiness that might occur. It has been about 3 minutes or so since we finished this treatment, and Hank certainly is not super red or anything like that. Keep in mind that I chose this side of his face for demonstration purposes today. If you get closer to the midline of the face, you could have a little greater histamine response. If you get closer to the midline of the face, you're also going to have less tolerance of topical anesthetic, so it's going to be a little more uncomfortable for your client. With that in mind, it's best to perform these in about a 15-minute session. This is not something that you can schedule a client for an hour and have them be comfortable and have the ability to treat them for that time duration without them becoming really uncomfortable. A lot of times clients will come in with cherry angiomas, for example. If you have one, you probably have 40 all over you, and cherry angiomas will reoccur. So make sure that this is something that the client can tolerate, that it does not leave a poor memory of the experience for them, so that they will retreat these surface imperfections with you over and over again. It's also important to give your client a firm understanding of what they need to do at home and when they need to contact you. Always have a before and after photo. Before the treatment and after the treatment, assigned consent according to your insurance carrier's recommendations, and always make sure that you have advanced insurance coverage for this type of modality.